Rabies is a serious viral disease of canines which is incidentally transmitted to humans by the bite of a rabid animal. It is caused by a virus known as Lassa virus type 1. The disease is of public health importance because it has a case fatality rate of 100% if a patient is not treated immediately after the bite. Once the clinical signs appear, it is too late. According to WHO, in up to 99% of cases, domestic dogs are responsible for rabies virus transmission to humans. Animals associated with rabies transmission are like foxes, raccoons, skunks, jackals, mongooses, and other wild carnivore horse species are very rare. Okay, mode of transmission. The rabies virus is transmitted to human through saliva of an infected animal, such as dog or cat. It spreads to people and animal via saliva, usually through bites, scratches, or direct contact with mucosa, e.g. eye, mouth, or open wounds. This happens when humans get bitten by a rabid animal. This means an animal infected by rabies, or when its saliva come into contact with mucous membrane or open wound of person. Dogs are the main host and transmitter of rabies. Contraction of rabies through inhalation of virus containing aerosol or through transplantation of infected organs has been described, but it's extremely rare. Human to human transmission through bites or saliva is theoretically possible, but has never been confirmed, as well as transmission to humans via consumption of raw meat or milk of infected animals. Incubation period ranges from 2 weeks to 1 year, with an average of 2 to 3 months. On clinical manifestation, the earliest symptoms usually consist of increasing severe pain in the bite wound, unusually or unexplained tingling, pricking, or burning sensation at the wound site, irritability, nausea, sore throat, headache, and loss of appetite. As the virus moves to the central nervous system, progressive and fetal inflammation of the focal inflammation of the brain and spinal cord develops. There are two forms of rabies: furious rabies. It lasts for 2 to 3 days and sometimes 5 to 6 days, and is characterized by convulsion, hyperactivity, hallucination, lack of coordination, irrational excitement, which alternates with periods of alertness and calmness. The patient is also unable to tolerate noise, bright light, aerophobia, fear of cold air, increased reflexes, muscle spasms, excessive sweating, dilatation of pupils, excessive salivation and lacrimation, meaning excessive tearation. The patient develops intense hydrophobia, fear of water, because of intense pain experienced when swallowing water due to spasms of pharyngeal muscles. Death occurs after a few days due to cardiorespiratory arrest. Okay, in paralytic rabies, this form of rabies runs a less dramatic and usually longer course than the furious form. Muscle gradually become paralyzed starting from the wound site. Coma slowly develops and eventually death occurs. Patients who reach this stage do not survive for more than 1 week. On pathophysiology, following inoculation begins to replicate in the skin or muscle tissue before it works its way into the peripheral nerves. It then spreads to the CNS in the endometrium of the inch-1 cells. Terminally, there is widespread CNS involvement and the patient presents with paralysis then to death. On diagnosis of rabies is made if a person is bitten by a dog with abnormal behavior and without any provocation. In addition, the presence of negli bodies in the brain of a suspected animal should confirm the disease. On management, there is no cure for rabies once the disease has started. It's however possible to prevent it from reaching that stage by doing the following. Post-bite prophylaxis. Immediately someone is bitten, you should give first aid treatment of the bite with the aim of removing as much virus as possible. This involves immediate flushing of wound, preferably with running water, and washing the surrounding skin with a lot of soap and water. Iodine is also virucidal and may be used to clean the wound. Bite wounds should not be sutured immediately to prevent more traumas from the suturing noodle, which will increase the area for viral entry into the body tissue. Suturing may be done 24 to 48 hours after the bite using very few sutures under the cover of anti-rabies serum locally. On how to handle a case of animal bite. If an animal is available and looks healthy, write down the name and address of patient and ask the person to come back for checkup after 10 days. The animal must be observed for 10 days. If it remains healthy during this period, there is no danger of rabies. If the animal shows signs of rabies, the patient should come to the hospital for immunization. If the animal has disappeared, the person must be immunized. If the animals look rabid, the person must be taken for immunization. If the animal is dead, it must be buried carefully and the person taken to hospital for immunization. On anti-rabies vaccine, this is a very safe and effective treatment following a rabid animal bite. The vaccine HTCV, Human Diploid Cell Tissue Culture Vaccine, is administered in 6 doses IM as follows: day 0, day 3, day 7, day 14, day 28, and day 90. Check out on categories of contact recommended post-exposure prophylaxis on WHO website. Prevention and control. Vaccinate dogs and cats against rabies as required by the law. All dogs and cats more than 4 months of age must be vaccinated against rabies. Keep dogs and cats under control. Animal control law prohibit allowing animals to roam unsupervised. Immunization of people. Immediately wash the wound thoroughly, cleaning and flushing with plenty of soap and water for several minutes. Immediately report all animal bites to your animal control agency, police department or health department for follow-up, identification and continual observation of animal if wild or stray to aid identification of signs and symptoms for rabies. Thank you so much for watching. You can check out my other videos. Don't forget to subscribe, like and comment. Bye.